Hi everyone, welcome to this segment of Anu Asks. And in this segment, what we hope to do is to dispel some of the myths and the fears. Whenever we hear the term ICU, உடனே பக்குன்னு மனசுல ஒரு பயம் வருது இல்லையா? அண்ட் எவ்வளோ நம்மளுக்கு தெரியாமல் போதோ புரியாமல் போதோ அந்த பயம் இன்னும் ஜாஸ்தி ஆகிட்டே இருக்கு. அந்த பயத்தை கொஞ்சம் குறைக்கத்தான் இந்த எபிசோடில் நாங்கள் ட்ரை பண்ண போகிறோம். We have joining us today Dr. Jagan. Dr. Jagan, many of us எங்களுக்கு ஐசியூ பற்றி புரியறதெல்லாம் நிறைய சினிமாவில் பார்த்துருக்கோம். அண்ட் சினிமாவில் பார்க்குறது ஒரு ட்ராமடைஸ் பண்ணி டிரான்ஸ்பரண்ட்டாக இல்லை, அது மாத்திரம் இல்லாமல் உள்ளே அலோவ் பண்ண மாட்டேங்கிறாங்க, அண்ட் தென் ரொம்ப எக்ஸ்பென்சிவ், இந்த மாதிரி ஒரு டெஃபினிஷன்ஸ்லாம் இருக்குது. And just like we don't want to get our medical information from Dr. Google, we don't want to get our medical information from the movies either. So what are the most common misconceptions about the ICU that you think we need to dispel?
Thanks to COVID, like post-COVID, we all realize like ICU is very important, and there is a specialized team which takes care of ICU, and that is one place in the entire healthcare system where patients, life and death scenarios happens. So when obviously life and death is so important, that is the most important place to concentrate also, right? And it is also very important to burst the myths which happens. So we'll start with this one, transparency. So honestly, from my side, I would say ICU is the place where the utmost transparency is there. But the problem is the complexity of the scenario and the emotional things which run there. So imagine like till yesterday, your close relative was absolutely fine, or near and dear are absolutely fine, and today morning someone comes and says like, okay fine, it is not going to be like this entire life, your life is going to change. Then it's more about acceptance than transparency. It is very difficult for someone to accept from here to here.
Correct.
And that is how a trained intensivist differs. So for example, I'm doing this for 10 years. Obviously, I know how to convey a thing. I may take 1 hour to convey a thing to a particular person, where in some other place I will take only 10 minutes. So that is where it is so important. And being transparent, see, for me, I still believe ICU is the most transparent place. And no other place people will tell like, okay, this is how it is going to be. You are going to be like this for the rest of your life. And see, allowing everyone into ICU, I will say this. See, it's not a very, to be very honest, our job becomes very easy if we can make an attender sit inside.
How does it become easy?
See, you just imagine like this. All the movies says like doctors are not working properly, people are not taking care properly. When you sit there and you see how hard people are working and how a whole bunch of team is working to get relatives better, you will also feel better, like okay fine, this is how it happens. Then our job is almost done.
So
what will be the result?
So why aren't we doing it?
See, the logic is it's only because of the betterment of the patient. For example, you just imagine we have got set protocols. The most important problem we have in ICU is infection, right? So cross infection, and so for example, I am training a critical care nurse for 6 to 10 years to prevent infection from one patient to another. I cannot train an attender for 10 minutes saying that okay fine, you just be like this, you make sure your infection doesn't get to them. It doesn't work that way. I cannot screen an attender also. And ICU is a dynamic place. See, at one point of time, one patient will be very sick. I'll be trying to make him comfortable. Suddenly, another patient ரொம்ப sick ஆயிடுவாங்க. அந்த டைம் நான் ஓடிக்கிட்டு இருப்பேன். கூட இருக்கிறவங்க மைக் அடிச்சு விடுனா அவங்க போய் யார் பார்க்குறது? And you have you ever imagined the dignity of patients? So எங்களை பொறுத்தவரையில எல்லா பேஷண்ட்டும் நீங்க பேஷண்டா பார்ப்பீங்க. எங்களை பொறுத்தவரை அவங்க another human being. So ஐசியூல போய் பேண்ட் சட்டை போட்டு ஃபுல் கவுன் போட்டு உட்காந்துருக்க முடியாது. ஆப்வியஸ்லி ஐசியூ has got its own dress code. ஸோ நீங்கள் ஒரு 30-year-old கேர்ள் ஒரு பெட்டில் இருக்கும்போது, ஈவன் தோ இட்ஸ் அ க்ளோஸ் டூ வாட் எவர் செட் அண்ட் டன், அப்படியே ஆப்போசிட்டில் இன்னொரு சைடில் ஒரு 30 year மேல் இப்படி உட்காந்து அவங்க அட்டெண்டரை பார்த்துட்டு இருக்கும்போது தே கேனாட் சைட் லைக் திஸ். ஸோ வாட் இஃப் த அதர் பேஷண்ட் ஃபீல்ஸ், ஐயோ நம்ம இப்படி பார்க்குறாங்க, அண்ட் ஆடிங் டு த ஸ்ட்ரெஸ் தட் வெதர் ஷீ இஸ் கோயிங் டு லிவ் ஆர் நாட், ஆடிங் டு வாட் எவர் ஹேப்பனிங் டு ஹர்.
On top of that, indignity வேற எதுக்கு?
You just imagine some of your own relatives sitting there and having this undergoing the same feel. True. And this is dignity part, but actually infection part is even more dangerous. I will tell you the simplest example. Because of more attenders, you end up in getting one small extra bug. One extra bug you are just getting into your system. It will do one of the two. Either you will die because of that one extra bug, or it will cost you some 6 to 7 lakh extra just to treat that bug. And it is very difficult to make people understand because they are emotionally level at that point. அவங்க வந்து till yesterday there will be something different. இன்னைக்கு காலையில் வந்து அவங்க வேற மாதிரி பார்த்தா they will be emotionally level. However well we tell, it's going to be very difficult for them to understand. Again, I'm telling ICU is the most transparent place in the entire healthcare system, and I have got many other reasons why we are not allowing them inside. At least these two are the most valid things.
And they're most important as well because they have a direct impact on the outcomes.
That is what more. See, we all strive hard only to get a good outcome. At the end of the day, patient goes out properly. So no doctor wants a patient lose a patient, right? So whether it's right or wrong, I'm being paid. That is something different. But at the end of the day, if someone goes out happily outside saying a thank you, that
amazing.
Is what is the most important feel we get. And no one wants to feel like, okay, fine, no one is going to be there, right? So at the end of the day, we should all know that we are also human beings and there will be some restrictions. For example, if an attender is sitting inside, patient has got a simple thing. So, for example, patient gets a vomiting and you would have dealt in a different way if there is no attender. The attender starts shouting and saying, something is happening, I would end up in giving more drug. I would have ended up in giving multiple drugs where nothing is needed for them.
Correct.
Usually, that doesn't work that way.
Right. And also, you mentioned a couple of things and I want to pick on those points. You said there are some complications that arise as a result if I have someone, an attender staying. But what would be the good qualities of an attender with a relative or a loved one in the ICU?
I would say like the most important quality will be willingness to listen. Okay, so for example, if I am going to tell something about a new problem my patient has got, okay, அவங்க வந்து நம்ம எக்ஸ்பிளைன் பண்ணுறதை வச்சு திருப்பி கேள்வி கேட்டு மடக்கணும் அப்படின்ற நம்ம கேள்வி கேட்டு இவங்க ஏதோ தப்பாக தான் சொல்ல போகிறாங்க, நம்ம கேள்வி கேட்டு இவங்க எப்படி தப்பாக தான் பேச போகிறோம், அந்த மைண்ட் செட்டில் வந்து உட்கார்ந்தா இட்ஸ் நாட் கோயிங் டு பி ஃப்ரூட்ஃபுல் ஃபார் எய்தர் ஆஃப் அஸ். And this is where trust comes. Whether you believe or not, whether even though it's a paid job, even though it comes under Consumer Protection Act, whatever it is, still only trust makes it run properly. Whatever it is, you can say like even after 100 years, this is how it is going to work.
And also, in fact, during COVID, one of the common conversations I had with many doctors, they say one is trust, the other is the faith.
Yeah.
The faith that I will get better. And I remember you sharing some experiences where you said the patient was so convinced that they are going to get better. It was such a tricky situation and that faith just pulled them out.
So, for example, we have not defined there are still many things which medicine has not cleared. Okay. So, for example, I have myself experienced, for example, a 30-year-old girl with whatever resources we had, with whatever team we had, we couldn't do anything better. But a 99-year-old, he came unconscious. The relatives told just only one thing. We were very positive. He is going to survive. And we have a marriage at home. And we know he is going to attend it. This is all they told me.
Okay.
And we kept him on ventilator. And 3 days, he was walking back home. And as a medical guy, being 10 years in ICU, I cannot explain that.
Yeah.
So usually the positive mind frame, see, this is out of experience. This has got nothing medical. This has got nothing, maybe I would say this is something philosophical.
Correct.
Okay?
Correct.
Usually the positive mind frame and the positive trust and faith, usually they get better. Sometimes patient used to tell me, sir, in 3 days on a phone, because some day I have a special interview there. I used to think like, I don't know whether you are going to get out on it or how come you have become, seventh day you are planning something huge. See,
but that's a lovely attitude.
100% those patients will come out. I am telling you this, 100%. And these are the things which we can see with experience. So after 10 years, I have just seen this.
Correct.
Whenever a patient says, there are scenarios where patients have counseled me. There are scenarios where attendants have counseled me. And every one of them has gone out properly.
Correct.
So usually trust and faith, whatever be it, however be it. So I have a simple question. Imagine, I have done my masters, I have done my specialization critical. Every place, there will be a person doing the same work, right? What is the difference? The difference will be compassion.
Correct.
And how we project ourselves or how we tell them what is happening.
Connect
with them. And And what is the difference you are going to gain out of it? It is only the trust and faith which is going to make the difference.
Correct.
For example, the doctor போனா கண்டிப்பா எனக்கு சரியாயிடும். That is how it works.
Correct.
And to be honest, you have to work in a place like this where you will understand this also. There are scenarios where for emergency patients to come and they used to tell like நான் 10 வருஷமா அந்த டாக்டர் பார்க்குறேன், எனக்கு அவங்க தான் இது. I have sent them back after stabilization. This has happened. That is how we believe in trust and faith.
So it all works together. அதாவது medicine, dedication, team, cooperation, trust, faith, everything.
This is how ICU. It's a highly emotional ground. ICU is a highly emotional ground. It's not like a OPD where you just come sit, okay, fever, okay, you just give this medication, you come back. It's a highly emotional ground.
Which brings me neatly to the next point. Highly emotional ground. You're making life and death decisions and you have to make it with rapidity. How do you deal with the emotional toll of that?
Probably I would say like, this is again, it may sound philosophical, but that is how it works. All good intentions, maybe in city you can find 10 top 10 intentions, every one of them will be philosophical. See, in the sense, you should first understand you are not the only person who is going to save the patient, even though 90% of the contribution will be from you. But many a times it's a huge teamwork. So for example, behind the screen there will be a nursing team. Without the nursing team, nothing works. So the proper dedicated nursing team is the reason how the patient feels.
Right.
Okay. So for example, whenever patient gets better, if you feel like you are only part of the team and everything happened because of the team, then if something bad happens also, you will understand, okay, fine, you have done your job and this is how it will work.
Correct.
So when you feel like I am the reason for everything and you want the result to happen, things won't work well, and most of the time people leave intensive care and go to some other smaller jobs only because of this.
Correct.
They will think like they have done everything, and 1-2 patients where they feel and they criticize themselves too high. For example, if something is not going okay, for example, if a patient is not responding properly in a way which I want to respond, I used to criticize myself for hours together. Patient attenders will not be saying anything. Patient will not be saying anything, but I will be criticizing myself. This happened. But over a period of time, we realize this is not how it works. When a 99-year-old guy who is supposed not to come out, just like that walks home in 3 days, then you realize, okay, fine. You have to do your work properly, then things happen.
Correct. And you touched upon one topic. I think what I'd like to bring out is, you're talking about a balance, isn't it?
Yeah.
You're talking about too much and too little.
See, this is about like, for example, in நிறைய இடத்துல பார்த்துருப்பீங்க, like அந்த bed number 3ல ஒருத்தர் இருக்காங்கல்ல, அவன் அந்த பேஷண்ட் அவ்வளோதான். See, this happens when you are only professional.
Correct.
Okay. So when I am seeing, for example, you go to a mechanic, he will say like bay 3ல இருக்க காரு, bay 4ல இருக்க காரு, because he's a அவங்களுக்கு தான் professional. They behave only as a professional.
Correct.
But இங்க வந்து when professionalism is added with, say, something like compassionate, அங்கதான் வந்து you change things. See, for example, maybe I am a movie buff, I could say this way, how Satyam Singh has changed everything. அங்க உள்ள போனோம்னா அதே படம் தான் ஓடுது. Nothing is different, but they will make you feel that you are special, right?
Correct.
நீங்க ஒரு சினிமா தியேட்டர்ல உங்களுக்கு அப்படி ஃபீல் பண்ணனும்னா, when you don't know whether you are going to live or die,
correct,
you should be made feel good.
Correct.
Okay, that is where this too little and too much. When you are too much into it, so you imagine like you treat a patient for 30 days. You just imagine there are patients who recover after 30 days and all. There are patients who cannot recover after 30 days also.
Correct.
Okay, so you imagine if you know someone over a period of time, say after 5 days, obviously patient knows that I am going to be the main doctor or whatever it is, and I am more compassionate. They will start communicating to us like a close relative or friend. So after a week, something slightly goes out of the way, it will really kill us. Honestly, it will hit us. So it takes a lot of maturity to come out of it. The problem is, if you don't be that much compassionate, obviously patient will not feel happy.
Right.
Obviously patient will not feel happy. They will feel as if they have been treated as an object. So you don't have a choice. If you want to be a warrior, then you should get prepared. No choice. You should be compassionate. You should get ready to take the call.
Correct.
And we have to spend some other free times in some other different way so that you can come back to reality.
Correct. And also heal yourself, because you've just been undergone Just as the patient and the family undergoes trauma, you and the entire team also goes through the same thing. So you need the time out to kind of center yourself, to ground yourself, and maybe even remind yourself of the happy endings. Yeah.
Obviously.
Because the one happy ending is going to give you the momentum and the propulsion to handle
sometimes
quite a lot.
You can't tell that. For example, in COVID, I have a very different experience of a patient was there for 30 days, and still now the entire family is like my family. That is how it works still now. And it's a very good feel.
Yeah,
You can't tell. So even though it is sometimes it feels so stressful, sometimes whatever certain, the highest reward is that.
Correct. And then that brings us again to the mental well-being. Considering it's so emotionally charged, so much pressure, and there's so much stress that is there on a regular basis. Lack of schedule. End time yaar venna unga tappunu kuppalam. So the mental well-being of the entire ICU team, how do you protect that, and are there resources available for this?
See, there are many ways of doing it. For example, I do it in a different way. For example, I try to take most of the toll on myself. So I try to prevent my team from everything and anything, so that they will do only professional work. I will do the compassionate part, and we usually allocate people. Like I used to tell them, okay, fine, today I'm not going to concentrate on these things. You have to concentrate on these things. So once you start taking orders, you have to do only the part. There's no need. And getting good team, and your 50% of work is done. For example, the team with me has been with me for almost 8 years now. Imagine like none of the doctors have gone out for 8 years. So it means you have to give and take. And for example, if I'm going to take after 30 days, someone gets out properly, and I want to take a proper break, I will tell like I'm not going to come for next 2 days. And unless it is a dire emergency or something where I have to come, they will take care. And the belief in the team, because for 8 years they know what I will do. So obviously, even if I'm not there, they will do what they do.
Correct.
So they do it properly, and the belief in the team is more important. Once you set your team properly, I think relaxation is not a problem.
Yeah.
You can have it.
Yeah.
And there's a famous quote by, I think, by A.R. Rahman sir, like you have to have attachment with detachment. So you have to be completely attached, and at the same point of time you have to be detached also. Yeah, but it's an art, you will learn it.
Yeah. This is something that, because if you get too attached, then when something happens, you're going to break. If you get too detached, you're not going to feel at all.
Exactly. This is what compassionate professionalism.
So
exactly.
You have to be that.
Somewhere in between, you have to strike
find that. And then the last question that I have for you: what is your advice to patients when it comes to choosing anything or any hospital, any doctor for their healthcare needs, especially critical points in their life?
I would say it in a different way. Okay. For example, we start with a simple example. So everyone will be having a car right now, right? So நம்ம வந்து இப்போ இந்த கார்னா ஒரு 5 சர்வீஸ் சென்டர் இருக்கும். எடுத்தோடனே நம்ம போய் ஒரு சர்வீஸ் சென்டரில் உட்காரப்படுது. We will try almost every time we will give one service center. At one point of time, one service center, the service will be good. We will feel like they are reasonable people. That's all we can get.
Correct.
அதுக்கு மேல repeated service கொடுக்கும்போது, then we will know they are good people. So you cannot choose your doctor at the time of life and death, right? Then when you have a simple chances, you should go. Maybe you do shopping, you do window shopping, you do different hospitals. For one fever, you go to one place, one fever, you go to one place. At one point of time, you will feel like these guys are compassionate guys, they are little straightforward, more transparent, and this sets for me. Then you have to build a trust on your own. Okay, without trust, nothing is going to work. For example, say, I want to tell, before ending, I want to tell just 2 scenarios, okay, where the loss is going to be for public or patients and not for the healthcare industry.
Correct.
For example, just imagine like there are movies where they portray like patient is already dead, just like the
சும்மா வச்சிருக்காங்க.
இது வந்து இதனால பேஷண்ட்டுக்கு என்ன, I will tell you what happens to the doctors and what happens to the patient. I will tell you easiest example. Last week, maybe 1 month back, we had a patient. So I had a call saying that ஒரு patient to ஒரு hospital, ex-hospital, during a procedure, patient has got some issue, heart cardiac arrest, patient has been dived. So இப்போ அந்த patient வந்து advanced care கொடுக்கணும். Can you take it? This is the call I received. Patient 32-year-old. Okay, so being a human being, being a doctor, you know what I should do? I said, okay, fine, you can shift the patient. That is what I can do.
Yeah.
Okay, so patient came. I cannot tell them, okay, நீங்க அங்கேயே இருங்க, நான் வந்து ஒரு தடவை பார்க்குறேன், அவங்க ஓகேவா வந்துரும்னு தோணுச்சுன்னா நான் எடுத்துக்கிறேன், வேணாம் அப்படிங்கிறத காமிச்சிருங்க. I cannot do that. So I asked them to share. The moment came, I realized patient is very sick. The probability of survival is going to be very less. Then I called the attendants and told them, this is how it is going to work. I am not seeing anything yet. Probably, usually, if the brain is not functioning, you have to wait for 24 to 48 hours. Then only we can decide. So I told them it will take 1 or 2 days. Then we can come to a point. If the brain function, anesthesia, the brain function, we will proceed further. This is what I told them. Within 6 hours, there was a big mob. They came. So I'm just telling an example. I'm not complaining.
Mob வந்துருச்சு அப்படின்னா it is quite scary, இல்லையா? And அவங்க வந்து என்ன வேணா சொல்லலாம்.
Yeah, exactly. So அது பாத்தீங்கன்னா 80% of the people அவங்களுக்கு என்ன நடந்துன்னே தெரியாது. But அதுதான் அவங்க தப்பாவும் சொல்ல முடியாது. They just came to help a friend. And I'm not telling like எல்லாரும் நல்ல டாக்டர்னாவே உத்தமங்க. I'm not telling that. I'm not advocating anyone. When we have seen the highest judicial system having a problem, when we have seen the highest temple priest doing a anything can happen.
Human beings
after all. This is where you have to select properly. That is what I'm trying to tell. So then I did an echo scan. You know, everyone came with the phone with the video recording. Then they came. I did the echo. I showed them a heart pumping there. Then everyone come. So in the meantime, I had a very interesting experience. A policeman came. Okay, because of the mob, policeman came. He asked me only one question. Doctor, உங்களுக்கு என்ன தலையில பெட் ஃபுல்லா இருக்கு, எதுக்கு இந்த பேஷண்ட் எடுத்தீங்க? அப்படி ஜிஎஸ் கவுண்ட் சொல்ல வேண்டியதானே, ஏன் இந்த மாதிரிலாம் பண்ணி தேவையில்லாம டென்ஷன் ஆகுறீங்க? Now a policeman can think like this. He is thinking rightly. Because நம்ம எடுத்து நம்ம தலையில மண்ணை போடுறோம்னு அர்த்தம். இது ஒரு டாக்டர் யோசிக்கணும்னு நான் இருப்பேன். So next time, for example, if I am going to have a repeated experience like this, everyone is a human being, right? You better full இருக்குங்க. You just imagine the other way around. Cost. இந்த பேஷண்ட் இல்லைன்னா இன்னொரு பேஷண்ட் இருக்கு போறாங்க, கம்ஃபர்டபுளா சேம் காஸ்ட் தான் வரப்போகுது.
அந்த ஸ்ட்ரெஸ்லாம்
இல்லாம நான் பேஷண்ட் நல்ல பேர் வாங்கி I will be happy with it. That 24 hours was a very difficult time for me.
How did the hospital deal with it?
See, that is how you should be gifted in working in a place where, see, our place is something different. For example, this ICU is my ICU. I'll be owning the ICU. Everything goes good, I'll be taking the credit. Something happens also, I'll be taking the credit. So obviously, they had backup plan. They had every including most administrative person was staying here till everything got sorted out. But most of the places you won't get this kind of backup.
Support.
For example, see, our medical director, he is somewhere around 65 to 70 years. He came and he stayed all throughout the night with me. Can you imagine, like, for my age, I can stay all throughout the night. He came and stayed all throughout the night. But every place you cannot get people like this.
Because I think what is very clear here is a lack of trust on one side, which is the public, and a complete trust from the team and from the hospital side on you. So you experience both the lack of trust and it, but thankfully for you the repercussions kind of was not so bad. But when I am a patient and my family has a complete lack of trust, then I'm the one as a patient who will suffer, right?
Yeah, exactly. See, imagine you just have 5% chance of survival. If someone known to me has a 5% chance of survival, I would like to take that 5% chance, right? So what if I'm not going to take a chance, and what if you're going to travel somewhere and on the way something happens? Okay.
Correct.
See, playing safe is what everyone wants. And this different portrayal of just for publicity, people portray it in different movies. Obviously, the users will be patients because they believe whatever shown in the movies. So, when this is where you should do shopping. You should know who is your right place, who is your right doctor. You just stick on to them. That's how it works. This is purely trust-based business. This is, I would say, like it's a trust-based business. You don't have this trust, and there is no point in having this. I will tell you an easiest second scenario. You have someone very close to you coming in an auto with chest pain. Okay, the hospital is 1 minute away, and before 1 minute, she's telling like, I want some water to drink and all. That means she's speaking. Just getting into hospital. Before getting into hospital, there was no movement, and nothing was there. Just 30 seconds or 1 minute back, she is arrested. You just imagine a scenario. You are taking her to an emergency. Maybe I am a doctor there. I am just seeing the pulse. There is no pulse. Now you tell me, if I know an attender, or if the trust is fine, or as a normal doctor, by ethics, I should believe the patient attender.
Correct.
That patient is
until 30
seconds
he was.
How do I know? I just believe that.
Correct.
Then I will start a CPR.
Correct.
If that is on my side, if God is willing to her to come out, probably in another 30 minutes she will come out, or in ventilator something. What if she is not coming out? What if another 30+ people are coming and they are going to tell, வரும்போதே பேச்சு முடிச்சு மேலே சும்மாவே வச்சு half an hour வச்சு உன்னால காசு அமைக்கிறதா பண்ணிருக்காங்க. You just imagine. Next time someone comes and tells like that 1 minute more than how can I believe? I can easily tell like pulse காணும் ஒன்னு காணும் சும்மா தான் பண்ண போறோம்.
So that lack of trust is also like a cancer, right? From their side, the lack of trust slowly comes into you, and you have a lack of trust, and therefore it's just playing safe, and therefore the only person suffering is finally the patient who would have had a chance otherwise.
See, I am telling this on this platform because the same thing can happen to my own relative, right?
Correct.
Some other place, somewhere else, in some other hospital, they may face the same problem. So it can happen to anyone and everyone.
Correct.
So this is where trust comes in. And whatever you say, see, medicine is so hard to learn. I will tell you, it took me to complete my MBBS, post-graduation, specialist. It took me almost 10 years. 10 years of intensive study and 10 years of experience of working to get where I am. And if you think you know better than me just on seeing Google, then I can only pity you. I can tell, okay, fine. This is what you want, okay, you take it, that's fine. So that is how it works.
Correct.
So it took not even 10 years of studies, it takes another 10 years of practice to understand how it works.
Because the situation is so different.
30% it is not in our hands. It is so dynamic.
Correct.
Things happen. Correct. And after 20 years, I am still believing in philosophy. Then you should imagine within 1 hour of searching in Google, you cannot find anything about it.
Beautifully said, Dr. Jagan. Thank you very much.
Thanks a lot. It's been a very wonderful opportunity.
So can you imagine what a deep topic this is, both in terms of the amount of information as well as the philosophical side to it. இந்த எபிசோட்ல இவ்வளவுதான் நாங்க கவர் பண்ணோம், பட் ஆனா I think this is a subject that we would like to explore. I hope that whatever you learned in this episode will help you control the unnecessary fears. I hope you will find someone you can trust, and I hope you are very well. Thank you very much.